So if you are like interested in becoming a medical biller or coder and not sure if the demand is still there, we're going to go ahead and discuss that in this video. What's up, everyone? My name is Kat, and I am a certified professional medical coder, certified professional medical auditor, a medical biller, and the owner of Superior Medical Consulting, where we provide superior medical billing solutions for your private practice. Please visit our website at superiormedicalconsulting.com to schedule your free consultation today. And welcome to Level Up Medical Coding. So, in today's video, I wanted to talk about the demand that we have for medical billers and medical coders. So if you are like interested in becoming a medical biller or coder and not sure if the demand is still there, we're going to go ahead and discuss that in this video. So I hope that you stay to the end so you can hear all my whole thought process about, this industry. It's been a lot of talk about the future of medical billing and coding over the years, but especially now since AI technology is, becoming more and more popular. People seem to wonder how AI will affect the healthcare industry, and naturally any jobs that has to do with what people deem as like data heavy analytical type jobs, something that quote unquote a computer can do. It always brings into question whether or not this is kind of like capable of, being taken over by that technology. So again, that's a topic for a different day regarding AI and technology and healthcare, industry. But I know that's where a lot of the concern stems from. So yeah, like I said, we'll go ahead and discuss the demand that we have for medical billing and coding right now. So before we dive into like the employment outlook and everything, I wanted to basically give like a little background history of medical billing and coding, tell you what it is and everything like that. So medical billing and coding plays a crucial role in both the patient care and to the patient itself. They want their charts to accurately reflect, the illnesses and diagnoses that is being reported to their insurance company. So, let's talk about medical coders. So, what is medical coding? Medical coding is the translation of diagnoses and illnesses into, terms that is readable, digestible for health insurances. So medical coders, they're like translators of healthcare. They take the complex world of medical records, diagnoses, procedures, and translate them into a standardized code that is understood industry-wide. This coding system allows for consistent documentation, and it is crucial for insurance claims, reimbursement purposes, and patient records. Now, medical billers, they're responsible for taking those codes and, placing them onto the claim form in the proper format, so that the patients and the insurance companies the patients can either submit the claims themselves for reimbursement, or they submitted to the insurance company directly. They ensure that the health care providers are properly reimbursed for any of the services. And, it's so important so that the practice, especially private practice, but all entities, keep a financially stable revenue cycle. So let's discuss why medical coders and medical billers is important for both patients and for the healthcare providers. So medical coders and medical billers, they accurately report or we should accurately report patients' information is, vital for their safety. When medical coders ensures that a patient medical history and treatments is accurately documented. It helps for the healthcare professional to make informed decisions about their patient care. Coders kind of audit the documentation to ensure that all the elements is being reflected, so that the insurance companies won't have a question, or if they do have a question, they can just clearly see in the documentation why the provider billed the certain CPT codes or HCPCS codes that they did, and actually that the ICD-10 DX codes that they selected is actually medically necessary and reflected in the documentation. So it helps to provide, quality care for their patients. Now, on the financial side, with the billers, they play a crucial role in maintaining the practice financial health. As I stated before, their work ensures that healthcare providers are fairly compensated for the services provided, and also that their patients are billed accurately and fairly for the services that they have received. In turn, it allows them to continue to offer quality care to their patients. Now that we know the roles of the coders and the billers, let's explore why this career is in high demand. So, the healthcare industry continues to expand with an aging population, with so many advancements in medical technology that's leading to an increased demand for healthcare services. Also, ongoing changes in the healthcare regulations, coding standards that require professionals that's well-versed in the latest guidelines, that's keeping up with the changes in the medical coding and billing process. You need someone that's kind of dedicated to keep up with all of that information. It's really hard for clinicians to be abreast of everything right when it happened. They usually are educated on the changes in the coding and billing world, but sometimes it takes a minute before those practices become habitual for providers. So that's where coders and billers come in, because we help educate the providers, help remind them of these changes to help, redirect their thought process into the new elements that's needed in the healthcare world. Also, like in today's age, post-pandemic world, medical coders and billers are typically more commonly remotely working. And so this opportunity opens us up to be able to code and bill for, providers nationwide, maybe even globally, as opposed to just staying local. So I take that to think about maybe that you have like hospitals or clinics in like rural areas that, coding and billing may not be like the norm or may be popular, and it's hard for them to find a quality coder or quality biller, in their area. By us being able to work remotely, that allows the providers to be able to seek out more quality billers and more quality coders. And that also gives coders and billers, more opportunities to pursue, different avenues in their medical coding and billing career. So that's super exciting that, we have this newly advanced or accepted way to work. So let's talk about the employment outlook for coders and billers. I pulled up here a couple of websites that talked about, like the employment outlook for coders and billers. We'll start with the Bureau of Labor Statistics. They always give us projections of, where certain careers are going within the next couple of years. And they definitely have, an outlook for medical billers and coders. So the Bureau of Labor and Statistics projects a significant growth in this field. Job opportunities are expected to increase faster than average for all occupations. And this in turn provides a stable career path for medical coders and billers. So according to BLS.gov, if you go to their website, you will get like your occupational outlook handbook. I don't know if you remember this or was exposed to this in college, but I know when I was in college, they used to send us to like the career center for some projects, and we would have to go look in this thick old book. It's called the Occupational Outlet Handbook. Look for our, major, the career that we wanted to do, and we used to have to look up to see certain statistics like what's the outlook, what's the typical pay for this career, like any changes that's upcoming, what the work environment. It gives so much information. I'm gonna put the website on the screen or in the comments, somewhere for you. But this is a great resource for you to look if you are, not in the industry yet and you just kind of want to know what the outlook is. So what I'm seeing, the last information they have is from 2022, and they are saying that most medical records specialists is what they have it under, has a starting salary of about $47,000 per year, which equals about $22 an hour. Now, again, that's just, they lumped everything, medical coding, billing, record specialists, all in one. So results will vary. I ain't even gonna say may vary. They will vary. You will sometimes make less, like $16, $17 an hour, depending on your role. You can sometimes make more, like upwards of $20, $30, $40 an hour, depending on your role. All depends on your experience, your education level, all that stuff. But this is just entry level that we're talking about. They saying that this job outlook is expected to, grow faster than average. They are saying that as of last year, there was about 15,000 openings for this profession. I believe it's more than that. I can't imagine that it's only 15,000. Medical records specialists, they typically work, on the computer. Most of them are full-time, but they are part-time. And they say that the results may vary depending on your state. So AAPC also do like a salary survey every year where they take actual people that's in the medical coding and billing field, and they actually send us a survey every year and ask us if we will anonymously, report our salary and let them know some information. They ask us some pretty thorough questions to kind of accurately see, reflect what employment outlook is. And so as of the last article that I can find on aapc.com, they did the 2022 report should come out soon, but as of the recording of this video, they only have up to the 2021, and it shows that unemployment was down for our profession, medical billers and medical coders, which is great news because that means that we wasn't affected by any of the job losses that had occurred. They also state that salaries are up, for medical coding and billing, in which I can attest to that. Salaries are, up with our profession. A lot of the people that I've spoken with, medical coders and billers, are saying that their employers are like reassessing their job roles and adjusting their pay accordingly. I'm sure that has something to do with all the government, situations that's going on with the labor market and things of that nature. But whatever the case may be, our salaries are going up. So they reported that let's see, those people with 31 years of experience or more reported a 3.9 increase in salary. New hires said they started at around $38,000 a year. And that actually was an increase of 3% over 2020. So that's exciting. And then they also have information here, like you can, it depends on your experience. So if you're in coding and billing, they're saying that the average salary is about 48,000. If you're in the auditing world, your average salary is probably about 63,000. And so on and so forth. So you can definitely take a look at AAPC's website, and they break it all down by credential, by education, by responsibility, by geographical regions. So like they're saying, for example, if you are pretty much like in the mountain area like Arizona, Colorado, the typical average salary is about 54,000. If you are in the New England area, that's like Connecticut, Massachusetts, New Hampshire, Rhode Island, their average is about 61,000. So it just really depends on, where you live at. It's so many variables that goes into the outlook and pay for medical billers and coders. So I know a lot of people always want to know about how much do we get paid, and it's so hard to answer that question because the cost of living factors in, the type of facility factors in, your years of experience, the credentials do factor in, but not as heavily as people may expect or may think, because it just is. It's more so have to do with the region that you live in and the number of years that you have coded or built, and the specialty. The specialty drives a lot of, the complexities that, you will have to deal with, which in turn reflects in your salary. So let's talk about job growth. So the we already talked about that. I'm sorry. So they said that it was projected to grow significantly over the next few years, which means that it's a stable career path. If you notice that during the pandemic, a lot of people had gotten laid off or redirected, reassigned. A lot of people changed jobs. We as medical coders and billers were still considered essential employees. So very few of us had lost our jobs during the whole pandemic. Not saying no one has, but very few of us did. And because we are in the healthcare field, usually our positions are recession proof. So, take that for what you would take it for. Like usually the healthcare industry is pretty stable anyway. So let's talk about different work environments. So medical coders and billers usually have a flexible work environment. We can work in like so many healthcare settings like hospitals, clinics, insurance companies, consulting firms, maybe even some quirky things, labs. We work in a variety of industries because, we're pretty much dealing with revenue. So, they kind of need us in a plethora of settings. Also, in this field, you do have so many paths for career advancements. So like medical coders, like once you get your base credential, usually is your CPC or your CCS, depending on which organization you test through. That opens you up to be able to take your career into many paths. You can decide if you want to just remain a CPC and just learn different specialties. If you wanted to go into practice management, if you want to go into auditing, if you want to go into compliance, if you want to incorporate billing into your into your world, into your experience. So it's so many career advancements that you can do in this field. I actually did a video on how you can map out your career. I'll go ahead and link it to this video so that you can, review that at your pleasure if you would like. But basically, AHIMA has like a career map. If you go onto their website, and you can kind of like plan out your whole career, which is what I did. So I highly suggest that you do that. It helped me to stay on track, to understand what I need to do in order to advance into my career. And it has worked for me so far. I realized what I wanted to do, which credentials I wanted to get, what education I still needed, what experience I needed, what is typical for the career path that I've chosen. And so like it helped me so much in order to, map out my career. And here I am about 10 years later. I have my medical auditing credential. I am now a coder 2 level 2 person. I have my own billing management service, and I am on my way to be a consultant, so it really helped. And I suggest that you check out ahima.org and map out your career if you have no clue what you want to do with your medical billing or coding credentials, or if you just need some guidance. So, in conclusion, I just wanted to say, I hope that it was very clear and very evident that the demand for medical coders and billers are still high. It's still out there. I don't care what's going on in the world. Like, you're still going to need to consult with a human, a medical biller, or a medical coder to make sure that everything is being billed properly, correctly, sequenced right, keeping up with the guidelines, keeping up with insurance policies, keeping up with, all the regulations. You will still need someone to do that. Will AI take over medical billing and coding? I don't know. But as of right now, the demand for medical billing and coding is here, and it is high. So if you are thinking about getting into this profession, do not hesitate. It was one of the best career choices that I have ever made for myself, and I don't regret it. I love the laid backness of working in medical coding. Medical billing, not so much. It's a lot of phone calls. It's a lot of follow-up, but I don't mind it. It's just that if you are a person that likes to kind of work independently, as well as in a team, but mostly independently, coding would be for you. If you are a person that needs the stimulation, needs the constant, talking to someone, the constant busy work, then billing would probably be more suitable for you. So, this is a stable career path. It's very rewarding. And like I said, I have no regrets. And I don't think anyone that has a passion for the healthcare industry will have any regrets as well. So let me know what you think. Are you interested in receiving your certification for medical billing and coding? Did this video kind of shed some light that the demand is still there and help to ease your mind a little bit? Let's talk about it in the comments below. Let me know what you think about this. And as always, I want to thank you so much for watching this video to the end. Thank you for being interested in medical coding and medical billing. If you found this video helpful, please like, share, and subscribe to the channel. And I will definitely bring you more information like this. And as always, again, you got any questions or any comments, any suggestions, you would like to share your experience or your 2 cents, please leave it in the comments below. I love hearing from you guys. I read every single comment, and I do try my best to answer every one of you. So until the next video, I will talk to you soon. Have a good day.